Cardiac arrhythmia, this is a life-threatening condition of hypocalcemia. And in this cardiac arrhythmia, in ECG, when you do a ECG for a patient, we see there is a prolongation of QT interval in ECG. And also occurs cataract due to chronic hypocalcemia. Now about hypercalcemia. The causes of hypercalcemia is increased intake, increased absorption of calcium, decreased excretion of calcium, and malignancy. And in case of malignancy, there is hypercalcemia is occur. The features of hypercalcemia is metastatic calcification. That means calcium is deposited in various soft tissue in our body. Various soft tissues in our body. That means in smooth muscle, skeletal muscle, connective tissue, where the calcium is deposited due to the calcium concentration is increased in the blood. Neurological symptoms, renal symptoms, gastrointestinal symptoms, and cardiac arrhythmia. Now we discussed about chromium. The source of the chromium is yeast, molasses, meat product, cheese, and whole grains. And its RDA is 0.05 to 20 milligram per day. The function of the chromium is glucose and lipid metabolism, cofactor for insulin, lower the cholesterol levels. And the deficiency of the chromium can develop symptoms like as a glucose intolerance and weight loss. Cobalt. Source of the cobalt is liver, pancreas, vitamin B12. And the recommended dietary allowance of the cobalt is not established till now. And the function is integral part of vitamin B12. And the deficiency of the cobalt will ultimately causes the symptoms of vitamin B12 deficiency. And it will ultimately causes anemia. Copper. It present in all tissue and its source are liver, kidney, egg yolk, and legumes. Its RDA is 2 to 3 milligram per day and function is integral component of the many metalloenzyme and take part in oxidation reduction reaction. Ceruloplasmin, lysyl oxidase, cytochrome oxidase, tyrosinase. So at first in enzyme, when I take your enzyme class, I discussed about metalloenzyme. Enzyme which when the enzyme is act, metallic substance is needed as a cofactor. These are the metalloenzyme. So copper is a very important metal or mineral for several types of enzyme activity. Take part in iron metabolism through ceruloplasmin. And its deficiency ultimately causes hypochromic anemia, neutropenia, osteoporosis, decreased pigmentation of the skin, and neurological abnormality. And inborn error of copper metabolism. This is a rare disease and this is X-linked recessive disorder. Genetic defect in absorption of the copper from intestine. Both serum copper and ceruloplasmin and liver copper content are low. Ceruloplasmin, this is a protein that carry copper in the blood. Very fatal condition manifest early in life. Brittle and twisted hair, depigmentation of the skin and hair, seizure, mental retardation, and vascular defect. These are the sign symptoms of inborn error of copper metabolism. And we call it Wilson disease. Error of copper metabolism caused by impaired copper excretion into bile, reabsorption of copper in kidney, and hepatic incorporation of copper into ceruloplasmin. That means increased level of copper in the blood. And in these cases, there is a interesting information I will give to you. I should give to you, that is, when this copper concentration is increased in our blood, we see it in our eye. There is a ring formed in our cornea, and the name of this ring is Kaiser-Fleischer's ring. Kaiser-Fleischer's ring. And only see it, we easily diagnose the patient as a Wilson disease. This is a rare disease, X-linked recessive. Now we discussed about fluoride. Fluoride is incorporated into the structure of teeth and bone. Its source is mainly drinking water. All of you, when you drink the bottled water, you see there is write about the concentration of the fluoride. So the main source is mainly drinking water. Function is required for proper formation of bone and teeth, and its deficiency causes dental caries, osteoporosis. And all of you see in advertisement of the toothpaste, you see that they told about that our toothpaste is fluoride rich. Why? Due to this fluoride is necessary for our teeth. So they advertise it by that our paste is rich in fluoride. That means our toothpaste is very effective for your teeth. So we got our information for various sources. Just open your eyes and thinking. So this fluoride is very necessary for our teeth, and this deficiency of this fluoride causes dental caries and osteoporosis. Now we discussed about iron. Iron source, animal source and plant source. Animal source are heme iron, that is meat, liver, kidney, spleen and fish. The plant source are green leafy vegetable, beans, fruits, guava, apple, pulses, cereals. Daily requirements. Male and postmenopausal women 10 to 20 mg per day, female 15 to 30 mg per day, and in case of pregnancy. In pregnancy, the demand of iron is increased, and this is 30 to 40 mg per day. Distribution of body iron. All body iron, that means total body iron, is 3 to 5 gram, in which hemoglobin is 2.5 to 3 gram, myoglobin is 300 milligram, heme containing enzyme is 0.5 to 1 gram, such as cytochrome oxidase. This is a heme containing enzyme, cytochrome oxidase, and these heme containing enzyme contain 0.5 to 1 gram iron. Plasma is a transparent 3 to 4 milligram. Storage iron, like as a ferritin, hemosiderin, 1 to 1.5 gram. In reticuloendothelial cells of the bone marrow, liver, spleen, iron binds with the protein called apoferritin to make the ferritin and is stored as a ferritin molecule, sometimes collages, and degraded from hemosiderin. So function of iron. Iron is constituted of the heme, so it is important component of certain vital compound such as hemoglobin, myoglobin, cytochrome oxidase, peroxidase. I told it about this cytochrome oxidase and peroxidase, very important enzyme, and they contain iron. And if there is iron deficiency occurs in our body, these enzymes cannot act properly. Synthesis of non-heme iron compound such as iron sulfur protein of flavoprotein, succinate dehydrogenase, NADH dehydrogenase, nicotinamide adenine dinucleotide dehydrogenase. So this non-heme iron compound form it, iron is also necessary. Through the above compound, iron participate in oxygen transport, storage and utilization. That means this above compound That means this hemoglobin and